Hi guys, hi everybody, welcome back to my channel. My good name is Dr. Claire Leticia. If you have not subscribed, remember to subscribe, press the notification bell, like, share, and comment. And for those who have subscribed, thank you, I really appreciate. So, today we're going to talk about something we call urinary tract infection, UTI. And before we start, last time we talked about tonsillitis. And if you have not watched the video, go to my channel, watch the video, and I will also link in the description box below. So let's start. What is urinary tract infection? I'm a UTI. So UTI is a bacterial infection affecting the urinary tract system. UTI simply is just an infection in affect urinary system, and it is caused by a bacteria. But so many people confuse between the risk factors and the causes. Causes, it something that makes you more prone, something that increases the chance of developing a disease. Hiyo ndo risk factor. And risk factors, we have so many of them that make you prone to getting UTI. And number one is women. Women are at more risk of getting UTI than men because women have a short urethra than men. What is the urethra? Urethra is a tube that helps to pass urine from the bladder. Bladder is like a bag that collects urine. So that pipe that helps in or a tube that helps the urine to leave the body from the bladder. That is called a urethra. So that's what makes women more prone to get UTI than men. Another risk factor is pregnant women. Pregnant women are at risk of getting UTI because the bladder, yeah, because of the baby growing, it puts pressure on the bladder that makes women urinate many times, and that put them at a risk of getting more UTI. Another risk factor that increases the chances of getting UTI is personal hygiene, poor personal hygiene. Those people who don't wash their toilet well, if you don't wash your undergarments, if you don't shower, if you don't clean yourself well, it gives you a risk of getting UTI. Another risk factor is previous UTI. If you had a previous infection, you are also at a risk of getting an infection. Another risk factor is holding urine for long. If you have that habit of holding urine for long, ukisikia kukojoa alafu bado unashikilia mkojo, you don't want to go and urinate, it gives you a risk of getting UTI because urine ni uchafu. So if you hold your urine for too long, you are at risk of getting UTI. Another risk factor is diabetes. If you are diabetic, you have a risk of getting UTI because diabetic patients urinate more and more. And also we have some feminine products that people use that are not medically proven. Also, they can cause UTI. So when you use something, if you're not sure what it is or how safe it is, don't, because it can cause an infection ama UTI. So what are the symptoms of UTI? How will you know if you have an infection? Number one, you're going to have pain when urinating. Another thing, you can have pains on the lower abdomen. Another thing, you can have frequent urination, and when you go to urinate, you pass small amount of urine, and also you can get something we call urgency, is that you feel pressed, and when you go to urinate, you urinate very small amount of urine. You feel very pressed, and then when you go, very small amounts of urine comes out. And also, you can have blood in urine. Yes, it is possible. If you have UTI, you can also have bloody urine, or you can see some blood when you're urinating. Some people also get fever. Some people also get general body weakness, and joint pains. And so those are the commonest symptoms of UTIs, and a urinary tract infection. And also another thing I forgot about the risk factor is that also sexual activities can cause UTI. Put you at a risk of getting UTI. And it doesn't mean that if you get UTI from the sexual activity, your partner has multiple partners. No, you can get UTI just from the sexual activities. So that's all for today. Thank you for watching. Remember to subscribe and comment. If you have any question, ask down below and tell me what you want us to discuss next. Thank you.